CVS Caremark is the pharmacies. They're the pharmacies. Aetna Medicare supplements. Please know that's separate at Aetna than the MA products. Please know also that we will be bringing a training on supplements and ancillary products here shortly, and it will be a virtual training. We do obviously Medicare. Oak Street Health, as I mentioned, is our value-based provider. And then we have CVS Minute Clinics and CVS Health Hubs. Does anybody know what the difference between those two is?
Value-based care.
Value-based care, but between Health Hub and CVS Minute Clinic. So the main difference is that you can get pretty much everything you can get at a Minute Clinic at a Health Hub. Health Hubs go a little bit deeper. They also provide like therapeutic type treatments and that kind of stuff there as well. Okay, so they just go a little bit more into detail, more in depth, if you will. Yes, they are in CVSs, but not all CVSs have either a Minute Clinic or a Health Hub. Okay, here we go. And the other thing that I want you to know is that with the exception of our prime plans are the plans that are part. Prime is the network. Just keep in mind, prime is a network. Okay, so all of our prime plans, they are in the prime network. The prime network is only in Maricopa County. Other than that, every single one of our plans have either a travel advantage on the HMO, which allow our members to cross state and county lines, as well as be out of the service area for up to a year. One of the things that we find that very useful here, like in this area, for example, is people who live in Pinal, who still want to maybe come to see some specialists in Maricopa. They can easily do that. In Mojave County, it's a great plan because our HMOs, because they can go over to Vegas to see their specialists and not have to drive all the way to Phoenix. Again, they can cross state and county lines as well as be out of the service area for up to 12 months. Same deal with our PPOs. It's just called the Explorer plan on that one. We just recommend that you contact our member services to make sure that you have the right care where you're going. And then, of course, again, just keeping in mind, we have over 1.2 million providers nationwide, over 10,000 pharmacies across the country. We have dentists, like I said, our dental network. I haven't seen a dental network that compares to us yet, but I can't say we're the best. Just kidding. I'm not, but I didn't say that. But again, so you can travel with our plans, right? So for the most part, that's one of the greatest benefits about our plans. People who want to travel, they enjoy that. Value-based provider partners. I mentioned that we partner with everyone. CVS is a multi-payer organization, so we don't discriminate people who want to pay us money. I'm just kidding. So although Oak Street Health is our value-based provider, we just got Evernorth in June, even though we just sent out an announcement saying that they joined our network in January. They started in June. One Medical, Archwell Health, Centerwell, and Village Medical. I'm going to very quickly just point out one thing. Oak Street Health, Centerwell, Archwell, and One Medical. So the O's and the Wells are part of our high value provider incentive program. Okay, and we'll talk about that a little bit more. That being said, let's go into our lead plans. So first and foremost, just some of the benefits that are available on all of our plans. Our dental, as I mentioned before, we had a great dental which covered any code. At this point, we are doing some medical necessity claim edits on these. Let's see. Another thing, our members can go to any licensed dentist that they want to. Okay, just remember that in network we cover the care at 100% up to the benefit amount, and if they go out of network, is 50% of the usual and customary, of course. But yeah, so that's very important. And again, we have a huge network. So if a member really wants to stay with a dentist and they're out of network, please ask them if they would consider being a part of a network, and we'd be happy to do an outreach as well, right? Just to try to help your member save money. Also will help you for them to know that you have a connection at the carrier that can try to help and accommodate their needs, because we always want to do that. And it also makes you look really good, right, to your clients. Eyewear, our members can pretty much go, they have to go to a iMed provider. Oh, I just realized I didn't put iMed on here. But iMed is our network for that. Please know that iMed is a huge network. You're not going to see iMed on all the billboards. It might be Target Optical or something like that, but they're part of the iMed network. So do contact iMed to find out which are their locations near you. As long as you see an iMed provider for your eye exam, you're good to go. But you can purchase your hardware anywhere you'd like and submit for reimbursement. You can buy it obviously with the provider, and they will bill us directly. But you can buy it at Costco and pay up front and get reimbursed. Okay.